Children between the ages of 12 and 17 years can now get inoculated against COVID-19. The health department says this age group will receive only one dose of the Pfizer jab. There won't be any vaccination sites at school premises, though, as learners prepare for their final exams. Let's get you a sense of how this is all playing out. Bring in our reporter on the ground, Tshegohaco Moagi, who's also with the Basic Education Department spokesperson, Mhlanga. And Tshegohaco, before you speak to Elijah, get us a sense of where you're at and what you're seeing as of this hour.
Well, good morning, Ayanda. We are currently at Fumana Comprehensive School. This is in Katlehong in the East Rand. And this particular school, you know, is well known for various things, including their choir. And we will be speaking also to principal, to the teachers here, including the parents, around the issue of whether they will give consent to their children to get the vaccine. And this is, of course, the big issue, the issue around consent for minors. And to give us more details about what they are doing in this regard, we are joined by the Basic Education spokesperson, Mhlanga. Elijah, thank you so much for your time. Let's start with the issue of consent. This is a concern for a lot of parents.
Well, it shouldn't. The issue of consent should not be a concern at all, because the basic education sector has experience in administering similar initiatives that address the health and well-being of learners. Together with the Department of Health, we have worked together. We even have a form which we distribute to our parents because we want them involved in the decision-making process when it comes to any medical matter that might involve their children. So we want to allay the fears of parents that we are not going to force you to do anything that you don't want. The right to choose remains important, and we hope that a conversation will happen in the home for the child and the parent to agree on whether the child must get the vaccine, but we strongly recommend that they do.
Now, we do know that there won't be any vaccination sites on the school premises because of school exams. Is there a plan between yourself and the Department of Health to actually have vaccination sites at some point to make it easier for learners who would actually want to get the vaccine?
Access to the vaccine is a big issue. We have a large system. We have about 13 million children in 25,000 schools around the country. So we need to find a structured way of making the vaccine available to them at some point. Of course, the announcement was made only on Friday last week. So we need to now discuss the implications of that announcement as it relates to the basic education sector at this time, remembering that already matric exams have started in this very school where we're in. Yesterday, 39 learners wrote computer applications technology, which means the exams have started. And from the 27th, many other children will also be coming through to write at matric level. That means any activity that could disrupt the exam is not allowed and is not advisable, but also the medical issue regarding the reaction to the vaccine itself could also have an impact on some of the learners, as we know that some people react differently and they might need a day or two off. We don't want to cause those disruptions. But what we say is that those that fit those that belong in that category, 12 to 17, and are not at matric, they should go to the other sites to get vaccinated. But we are going to have a meeting with the Department of Health on Friday, where we're going to discuss and finalize plans on how we are going to be rolling out the vaccination program for learners early next year.
Now, I'm glad you mentioned the issue of side effects for people that actually take the vaccine, how some people may feel. What then happens if a learner between the ages of 12 and 17 actually does get the side effects and they need to be writing an assessment test or an exam during that period?
Well, the schools will have communicated the timetable already by now with parents. So parents will know when their children are writing which subject and plan accordingly. If there's a few days in between exams, then it could be safer to go get the vaccine. If not, then don't do it, because we don't know how you're going to react to it. Rather wait and do it at the right time when exams are over. So the exams are not going to continue forever. At some point they will end, but the vaccination program will remain in place. So it's never too late. Waiting to finish the exams could also be a good thing, which we actually recommend. But otherwise, if you feel that you're in a good position to go for it, do that today. It's open. The vaccination sites are there. The Department of Health has made that commitment that whoever goes there between the ages of 12 to 17 will get assistance.
All right. Thank you so much, Elijah Mhlanga. He speaks on behalf of the Department of Basic Education, really just giving us details about their work in all of this, Michelle, as they actually get into, as the Department of Health prepares to vaccinate that cohort of 12 to 17 years old.
So, Moagi, thanks very much indeed. Live to us there from Tshegohaco.